name's Ayla. I'm going to be your student nurse today. The doctor has ordered a nasogastric tube to be placed. Do you have any questions about what that is or what the procedure for it is? All right, and will you go ahead and tell me your name and date of birth? All right, and do you have any allergies? All right, and have you ever had any facial fractures or a deviated septum, anything like that? All right, so throughout the entire procedure, I'm going to keep in mind my general principles and safety practices. I've done my hand hygiene and I've pulled the curtain to provide for privacy. So to get started, I'm going to start by measuring the tubing. I'm going to start from the tip of the nose to the earlobe down to the xiphoid process. I'm going to mark that with a permanent marker. You can also use a piece of tape to mark it. I've got my patient sitting in high Fowler's with a water-soluble pad and a basin in case the patient were to get sick during the procedure. And I've asked the patient if they have a nostril preference, and I've also checked the patency of both nostrils by occluding each nostril. So I'm going to put on my gloves. And I'm going to lubricate 2 to 4 inches of my tubing. I'm going to instruct the patient to tilt their head back, and I'm going to begin to insert into the nostril that we've selected slowly. And if I meet any resistance, I'm not going to forcibly push through. I'm going to just twist my tubing. And once I reach the pharynx, I'm going to instruct the patient to tilt their chin down to their chest. If there's any type of distress, I'm going to stop the procedure. Any persistent coughing or gagging, I'm going to check the placement in the back of the throat with a tongue blade and a flashlight. And then once I meet my marker, I'm going to stabilize it and I'm going to secure it to their cheek. And I'm going to call the doctor and have them order a x-ray to check for placement, because an x-ray is the gold standard for checking placement. So after I've got that taped to their cheek, I can check the pH with my pH strip here. I'm going to make sure that this stays above their above the stomach level. And I'm going to check the pH. pH is good. Once the x-ray comes back and the placement has been determined that it's good, the placement's good, I'm going to remove this tape from their cheek. I'm going to place tape onto their nose. And you would obviously be using medical tape, definitely not painter's tape. All right. And then once it is secured to their nose, I'm going to remove my gloves, do my hand hygiene, and I want to make sure this is either set above their stomach level or if it needs to be hooked up to suction. I'm going to do my hand hygiene, make sure I document, and in my documentation, I'm going to make sure that I put the amount of tubing left outside of the body. And I'm going to make sure I encourage oral hygiene every 2 to 4 hours or assist with. every 2 to 4 hours. And I'm going to provide for comfort as much as possible and come back and check, see how they're tolerating it.